What is the PCP high like, and what is the detox like? From the perspective of seeing it in a psych setting, and what typically helps if somebody is going through PCP or PHENCYCLIDINE withdrawal. Please like and subscribe to the channel. This is your daily dose of mental health. All right, now first things first. Somebody using PCP or PHENCYCLIDINE, to anyone out there using it, please reconsider it, because it truthfully does destroy your frontal cortex and your decision-making skills and your impulse control and everything else. But that's beside the point. What the PCP high is like as an RN in the psych setting is when somebody is actively high on it, if they've come from the ER over and they've been medically cleared, but they're still actively up there. Emotions will be very high and low, and then they just go high, high, high again. And they don't know exactly how PCP affects the brain, but there is a lot of speculation and studies that have shown that it affects your dopamine and your serotonin chemicals, or in your receptors. So the problem is, though, it's because there's a lot of drugs that activate those two together, but they don't know in what way, meaning there is definitely disproportionate amounts when it is released during this time, which can lead to those drastic mood swings, that paranoia. But when you're actively using it, and you're when you actively high, and what they like and what they enjoy about PCP is, they say it's kind of like alcohol, feeling drunk, with somewhat of a speed effect and a mild hallucinogenic. Now the hallucinogenic's very ironic, that part of it, because I'll talk about that a little later. So the key is, when people say they're using it, they're like, oh, I used it and had an amazing experience, then I had a horrible experience the next time, and a horrible experience the next, and what they're trying to go for is that the good experience they had on it, which it's very hard to have. So yes, an alcoholish feeling with a bit of with an upper feeling as well, to an extent. But outside of that, that's what they say are kind of what the high is like. Now, two problems arise if you're actively enjoying it. What happens when that effect wears off? And what happens if you use a lot of it, you have a psychotic episode, and you start seeing things, and then even when you come down on it, you're still in that active state. That's what I want to tell you. So, if, let's say for example, you've been using it, then you use it, this next time, and you've been having these good experiences or trying to chase them, and this time, let's say it could be laced, it could be who knows what. Our brain chemistry is different day to day. Some days you could have a good or a bad high. Say this time you use it and you're literally seeing things, you're tripping, you're high, but you notice you're feeling hotter, your body temperature is rising, you're feeling paranoid. And the biggest thing I will say is with the active psychosis part, when you get too high on it, and this is where it gets really scary in a psych setting, meaning let's say they've used too much of it, and let's say it's even been 24 hours and they're still out of their mind, but now you add agitation to it and more paranoia. And if you look them in the eyes, someone who's on PCP actively high, a lot of times that in their minds can signal to them, they're paranoid, keep in mind, you're out to get me. You're going to do something to me. They're thinking of it, the person using PCP is thinking about something, and then you come into their field of vision and you're staring at them. They're going to see you most of the time as the bad person. That's the reality of it. And this can happen when you do get too high on it, but in particular, if you get too high on it, going into that psychotic state. Now let's briefly talk about what I mean by the psychotic state, because I'm sure you're like, wait, you've been bouncing around from way too high to psychotic state. So if somebody's in a psychotic state on it, typically that means they've used too much of it. And what a psychotic state is, you lose the ability, and this is with drug-induced PCP, you lose the ability to make decisions. Heck, even sometimes you lose control. I've seen this, of when your impulses are so badly gone, you'll just decide to pee on the ground, drop a poop, take a dookie, one or the other. Your decision making's gone. Your muscles can go from very, very, you can't feel them, to super tense. You're angry at anything and everything that is around you. In the psych setting, when somebody's in this state, their strength goes up like tenfold. Your strength does, and having to get them to calm down it's tough. Now let's real quick just jump real quick into detox / withdrawing from it / coming down from that psychotic state from a clinical perspective. From a clinical perspective, typically what we will do is, first off, if they're aggressive and whatnot, one thing we'll do, and if they're aggressive, they're not making right and just decisions, a lot of times they will get a shot of Ativan, Benadryl, and Haldol, or sometimes the doctors would rather do Ativan and Benadryl, or sometimes Ativan and Gedon, depending on it. But typically they do want to have Ativan on board to help with the anxiety aspect of it and the paranoia they're having. They'll push sometimes 2 to 4 milligrams of it, and if that helps with the anxiety part to where their heart rate's coming down, a lot of times, if they're delusional, seeing things, then they'll give them an antipsychotic. But the key is, a lot of times, is when somebody's coming down from it or they're hallucinating. A lot of times we want to be very careful on giving them antipsychotics too, because one thing that can come from that is antipsychotics in themselves do have side effects. They can cause EPS, they can cause abnormal tongue movements, they can really make it where you're just cramping. Your muscles are cramping a lot of the time. Another thing too with PCP, why sometimes the psychotic episode prolongs and can go for weeks at a time, even, which I've seen, can be either they have a family history or there's a genetic factor in their case of having mental illness, like bipolar, schizophrenia, just you name it. And then you also have the aspect of, were they using anything before PCP or with it? Because a lot of times, as a drug user, a lot of times you're using multiple things, sometimes uppers and downers. If you're using uppers, sometimes you got to use a downer to sleep. So there are those factors that go into it. One thing that can also be, it's very interesting, but also it can be truthfully scary for family members, is they're like, why are they not getting better? It's been a week. Well, sometimes the toxins from PCP actually there's at least 50% that you don't lose, right? You don't lose, they stay in your system. Your kidneys don't process them the full way. And when you keep those toxins in your system, it can result in a continuous psychotic episode, or even it can for a little bit kind of go dormant even. And then, I've heard of one person who they were doing better and then they worked out. You're pushing your toxins through, that it goes through your bloodstream again, and he went to another psychotic episode. Now you might be asking, why am I talking about this? Because PCP is truthfully something, and I'm talking about this because it's from my perspective of it, is something that is truthfully scary to see somebody go through. It's honestly horror sometimes, and I'm not gonna lie, it can be very scary. And just some of the results and long-term problems that arise from people who are using PCP, as I said. Sometimes antipsychotics have to be prescribed long-term. It just depends case by case. But Another thing, and then I'm gonna end it. I'll be done with the video. There's not really much when somebody asks, how do you make the withdrawal easier? A lot of times the withdrawal for people is, one of the side effects of using is having a psychotic episode. But if you are withdrawing, if you're getting off of it, you'll want to make sure, obviously, you're eating right, you're getting your vitamins in, your B vitamins in particular. You also have to remember that it will be scary, and you could have moments where you have flashbacks using it. This is what patients have talked about. You can slip back into that that hallucinogenic state sometimes if you put too much anxiety on yourself. And also the depression is another thing that can sometimes be addressed. But typically with a lot of psychosis episodes, an antidepressant wouldn't be started until at least 2 to 3 weeks after it, just because your brain chemicals they're out of proportion. You don't want to hit your brain with something all at once. It needs to somewhat adjust again. But sometimes an antidepressant would be prescribed. The best thing you can do, though, is to quit anything is, in my opinion, any drug or any substance. As I've said, you've got to be the one to quit. You can have family who wants you to quit, but you have to want to do it yourself. I love you all. That's your daily dose of mental health on what PCP is like, and from my perspective, what I've seen. My next video, I will be covering, I'm going to be doing the murder mystery, going over a case. And then after that, I'm just going to be doing an update on my life, but we're going to continue to put videos out as much as I can. Love you all. Please like and subscribe and leave a comment.